My client injured her foot, knee, had limited hip extension. We addressed all of those things, restoring normal movement. And then checking she had a twist in her sacrum, blocked motion in the left lower quadrant of the sacrum. We restored that. And then I worked up the body and found that she has a rib on both sides. It's hypomobile, okay? And that's this rib right here, okay? So the bottom of your scapula is here, so this is rib number 8, and so this is 9, and so this is 10. So it's rib number 10 or 11. Okay, this one moves. I think that's 10. That would make this number 11, and that doesn't spring, okay? And then we have number 12 here, 12 springs, okay? And then you're fresh out of ribs. So yes, rib number 11 is hypomobile on both sides. Yep, it's not moving. I can't spring it on this side either, but I can certainly spring the one above that. And I had a friend in Las Vegas, and he was getting frequent adjustments to his lower thoracic spine. And those would help his belching, but it was transient, okay? And right here we don't have spring mobility of that vertebral segment. I cannot get spring mobility. Right below that I can get spring mobility. And it's very rare that I will make any kind of claim of being able to treat visceral problems. But in his presentation I found the same thing. I found a lack of mobility of what I thought on him was T10, and the ribs were compressed on both sides. So I think that what the missing piece was that the ribs were not freed up first. And so I mobilized both ribs, distracting them, okay, and then I did a flexion manipulation to T10, and his belching was significantly improved, and it lasted for years. I continued to follow him up from time to time, and his mobility in that segment continued. So sometimes there is a connection between some visceral phenomenon and spinal and rib mobility, but that's pretty rare. It will be interesting because you do have some GI symptoms, and it will be interesting to see if those change in response to restoring mobility here. But what I'm going to do is I'm going to distract the ribs laterally. I'll do that on both sides. And if that doesn't restore mobility, then I'll do the opposite. Then I will compress the ribs in towards your spine. After that, I'm going to have you lie on your back, and you're going to bend your spine forward, and I'll use my hand there and then do a gentle flexion manipulation. So I'll stop filming now, and we'll treat you, and we'll film the response to the mobilization afterwards.